Anxiety and anxiety are popular psychological wellness disorders that can easily considerably impact an individual's quality of life. Each conditions may result in a selection of physical and psychological indicators, featuring feelings of misery, pessimism, shame, concern, worry, and anger. While treatment is a necessary element of therapy for depression and stress, medication may also participate in a crucial part in dealing with signs. Medications utilized to handle depression and anxiety drop into many categories: selective serotonin reuptake inhibitors, SSRIs, serotonin-norepinephrine reuptake preventions, SNRIs, tricyclic antidepressants, TCAs, monoamine oxidase inhibitors, MAOIs, benzodiazepines, beta blockers, and atypical. Each training class of medicine works differently to alleviate signs and symptoms. SSRIs are the very most frequently suggested antidepressants for clinical depression and stress and anxiety. These medications operate by boosting the degrees of serotonin in the mind. Serotonin is a neurotransmitter that moderates state of mind, appetite, rest, and other functions. SSRIs feature medicines like fluoxetine, Prozac, sertraline, Zoloft, citalopram, Celexa, escitalopram, Lexapro, paroxetine, Paxil, and fluvoxamine, Luvox. SNRIs are similar to SSRIs but likewise boost the amounts of norepinephrine in the mind. Norepinephrine is an additional neurotransmitter that plays a job in mood requirement. SNRIs feature drugs like venlafaxine, Effexor, and duloxetine, Cymbalta. TCAs were one of the first classes of antidepressants established but are now much less typically recommended due to their edge results. TCAs work by increasing levels of both serotonin and norepinephrine in the brain. TCAs feature drugs like amitriptyline, Elavil, and imipramine, tofranil. MAOIs were also one of the initial courses of antidepressants created and are right now much less generally prescribed due to their communications along with specific foods and medicines. MAOIs work by inhibiting the chemical monoamine oxidase, which breaks down neurotransmitters like serotonin, norepinephrine, and dopamine. MAOIs include drugs like phenelzine, Nardil, and tranylcypromine, Parnate. Benzodiazepines are a class of drugs utilized to treat anxiety ailments. These medicines work by boosting the results of a neurotransmitter contacted gamma-aminobutyric acid, GABA, which lessens activity in the brain. Benzodiazepines include medicines like alprazolam, Xanax, lorazepam, Ativan, and clonazepam, Klonopin. Beta blockers are one more lesson of medications made use of to manage stress problems. These medications function through shutting out the effects of adrenaline in the body system, minimizing physical signs of anxiousness like sweating, palpitations, and tremblings. Beta blockers feature drugs like propranolol, Indarol, and atenolol, Tenormin. Atypical antipsychotics are a training class of medications used to manage anxiety that has not answered to various other treatments or is gone along with by psychotic signs and symptoms like delusions or aberrations. These medicines operate through impacting multiple neurotransmitters in the human brain. Abnormal antipsychotics consist of drugs like olanzapine, Zyprexa, quetiapine, Seroquel, risperidone, Risperdal, and aripiprazole, Abilify.